And Chair Rubin, you may begin.
Good evening, everyone. Welcome to today's Civilian Oversight Commission's virtual town hall on law enforcement interactions with people who have mental health conditions or developmental disabilities. The Commission's town halls are designed to lift up community voices and create a safe space for leaders and community members to share their observations, thoughts, and suggestions. We would like to hear from each of you about your experiences with law enforcement in their crisis response to incidents involving people who have mental health conditions or developmental disabilities. We'd like to hear more about public safety needs of these community members and their families, and about law enforcement efforts to effectively serve people. With all of this, we hope you share some ideas and action items to reduce negative interactions or improve outcomes of these exchanges. Although, as I said, we focus this evening on issues and concerns of people who have mental health conditions or developmental disabilities, the guilty verdicts against Derek Chauvin have given us some measure of accountability. It is only the beginning, however, in establishing real change and true justice for all Black and Brown communities. The Commission will host a community listening session on Tuesday, April 27th, where you are invited to share your reflections and thoughts and hear strategies we can all use to address our trauma and stress often associated with interactions with law enforcement. Please join us on Tuesday, the 27th at 5:30 as we join this community effort. You can learn more and register to attend by visiting our website, coc.lacounty.gov. We will also sponsor future town halls dealing with the issue of where we go from here. If you are posting or tweeting during tonight's town hall, feel free to tag us on social at LA County COC. This evening, we have a terrific panel of speakers who will share their expertise before we hear from you, members of the community. Our guests are Dr. Piero Dengillo, clinical psychologist for Los Angeles County Sheriff's Department, Dr. Jonathan Sherin, director of LA County Department of Mental Health, Mark Gale, criminal justice chair of the National Alliance on Mental Illness from Greater Los Angeles, NAMI, and Judy Mark, co-founder and president of Disability Voices United. You'll also see a few additional leaders in the community who will be listening to your feedback. They include Gustavo Mendez, a public safety commissioner with the city of Cudahy, Darrell Williams, who is the chief deputy in the Office of Inspector General, LA County Civilian Oversight Commission vice chair, Casimiro Tolentino, and our executive director, Brian Williams. After listening to community feedback and conducting research, Civilian Oversight Commission staff work with ad hoc committees to prepare recommendations for the Board of Supervisors, the Sheriff's Department, and the public. As the Commission works to boost transparency, accountability, and community input, all of these drive the ongoing analysis of the department's policies and procedures. And when it's time for the live comments, as a reminder, you'll need to be logged into WebEx. If you're watching on Facebook or listening over the phone, you'll not be able to provide live remarks. The WebEx login information can be found on the Commission's website, coc.lacounty.gov. For those logged into WebEx, if you'd like to make a comment, please raise your hand in the participant window to get in a queue. You can also use the chat box to message the host. And now I'm going to turn the discussion this evening over to our first speaker, Dr. Piero Dengillo, a clinical psychologist from the Los Angeles County Sheriff's Department. Dr. Dengillo, welcome.
Good evening. Thank you. And beside me, although you can't see him, I have my colleague, Dr. Jose Navarro. He and I are the primary instructors, actually the instructors for the Sheriff's Department patrol crisis intervention classes, and I'll get into that in a few minutes. What I'd like to share about is my voyage starting 2004 with being a psychologist with the LA County Department of Mental Health and being assigned to the LAPD's mental evaluation unit. So SMART, as many of you may be familiar with, is a police officer paired with a mental health clinician. And so over the course of the following 12 or so years, I remained with DMH and had a chance to work with SMART, had a chance to work with the mental evaluation team here at the Sheriff's Department, also known as MET, and also worked PMRT, the Psychiatric Mobile Response Team, that's tasked with, those are the DMH clinicians who respond to community-based crises. Because of that experience about 5 years ago, Dr. Navarro and I were recruited by LASD to come and develop a training program for patrol relative to responding to mental health crises in the community. So as a result of coming here now, we provide that training again to department personnel. And at this point, the department has about 35 mental evaluation teams. That's a sheriff's deputy paired with a DMH clinician. It is a phenomenal program. I'm a firm believer in it because, again, I worked at LAPD, I worked it here, and I also worked that civilian format, which is the two clinicians responding as PMRT in the community. So briefly, I believe that the co-response model is as essential as having paramedics at a fire station. How many of you want a fire station without paramedics for that emergency, for that medical emergency? I only have about another minute or two left. I want to transition into training to what Jose and I do. There are at least 6 to 8 types of mental health training classes that we provide in the Sheriff's Department, and Jose and I created the 32-hour class that we provide to patrol. We created that class based on our experiences out there with managing crises and never having an adverse outcome after all the many years and intense situations. Where we stand now is that we developed a response model that we don't believe is mirrored by anyone else out there, and we're actually talking with some of our advocate partners in the community about uniting with them and further expanding this response model. You may have heard of de-escalation techniques. Well, our response model is the de-escalation process. So we're excited about teaming up with some of our advocates / community members and sharing this response model that's designed for patrol, but also for mental health professionals and handling these types of crises in the community. So I think my time is about up. So therefore, I'd like to introduce Dr. Jonathan Sherin with the Los Angeles County Department of Mental Health, who serves as the director of the agency.
Doctor.
Thanks, Piero. And looks like you bailed on the Department of Mental Health right before I got here.
So
anyway, I'm really glad to see that we're talking about situations where mental illness is an issue and also developmental disability. I would say that we need to be thinking about addictions as well, which play a massive, massive role in terms of the need for crisis response and diversionary efforts and care and treatment. And I think that's forgotten way, way too much in general, but certainly in LA County, where the addictions services channel through a different department. And I believe we're the only county in the state where that is the case. I also just want to say out front that, what we're talking about here is trying to identify health and human service crises and to respond in real time with health and human service resources. And what we have done, I would say, over time, here and elsewhere, there's a lot of background.
Yes, The speaker that just spoke, Piero, if you could mute yourself, please, that would be helpful. Sorry about that, Dr. Sherin.
Yeah, no problem. What we've done, I believe, is really put the onus on law enforcement that, you know, to deal with scenarios where, again, Health and Human Service oriented resources would be best fit. And I believe that this reform type movement is looking to deal with that situation. We need to invest much more in how we get care out to the community in real time. We're nowhere near where we need to be. I mean, I can tell you that, and Piero can tell you. We get a call at PMRT, we could get 5, 10, 15 calls, and we only have a handful of teams. And this is a big county. So one of the things that this board and the departments and many of our partners, including law enforcement around LA County, is pushing is an alternative crisis response effort that I believe is huge. And I'd like to just start with that. What does an alternative crisis response system look like? And really, there are 3 basic components that we're working on. The first is a regional call center where issues that arise in the community can be brought into a coordinated type of call center that has a number of different experts on the health side and on the law enforcement side to understand what's going on, determine to the best of our ability what's the appropriate response, which is not always simple. And it oftentimes will involve law enforcement and Health and Human Service response. But we ought to be putting our best minds forward to understand what's going on and triage a call and deploy the most appropriate response. So in terms of the response and the responders, you know, we talk about, you know, the mental health teams, we talk about law enforcement, we talk about co-responders. And we have to figure out how to blanket this county with an adequate number of response teams to meet the demand. The demand has to drive the supply. And then when we find someone and that person needs help, needs care, where do we take them? A lot of the times there's nowhere to go. So we have to significantly expand what we call our receiving and stabilizing facilities. And really, in terms of gold standard, there's 3 types. There's the urgent care or crisis stabilization unit. There's crisis residential treatment beds. And then there's pure respite. And that combination of 3 different resources really can allow us to get people who have mental health, behavioral health crises, get them somewhere where they can be stabilized, where they can get care, and where they can then be triaged back into, connected to the community in a meaningful way. So I do want people to know that there are massive efforts at the highest level looking into and creating what right now is very, very piecemeal and nowhere near capacity through those 3 components. The other thing I'll just say really briefly is that the Department of Mental Health is investing significantly, not only in a promoter or promotora program, but in what we call the CAN, the Community Ambassador Network. And really that's an infusion of resources into communities, particularly for those communities that are most adversely affected right now and disenfranchised historically, to train, certify, and hire people of community, for community, by community, to navigate individuals who are suffering from mental health problems to care. And that, I believe, is a model that we can look at across the board. So it's not just about mental health services. It's about all the health and human service needs. And it's also about the ability for communities to become empowered and provide for themselves and care for themselves and not always have to rely upon the outside because they're properly resourced and they have that credibility, that trust that's inherent within neighborhoods, within communities. I think I'll keep it there, and I thank you, and I'm very honored to be here with you today.
Thank you, Dr. Sherin. I want to throw out a thought for all of us to think about. You don't necessarily have to respond now, but we're all aware of what tragically occurred several weeks ago to Israel Cervantes. I know Judy Mark is going to talk about him and about his family, but one of the big issues, one of the many big issues, really has to do with in a situation where a family has a concern about somebody who has mental health issues or disability issues, and they call 911 for assistance. How do we set up something? How do we create something so that somebody and the family ultimately receives help, and it doesn't result in somebody being severely injured or unfortunately died? So anyway, keep that in mind. And I want to go on to Mark Gale, who from NAMI, who has been working in this field for a very long time. Welcome, Mark.
Yeah, thank you, Lael, and I'm honored to be here. So for those of you who don't know who NAMI is, we were started in California in 1978, nationally in 1979. I'm with NAMI Greater Los Angeles County. We're the largest regional affiliate of the National Alliance on Mental Illness. We're a grassroots membership association dedicated to building better lives for the millions of Americans affected by mental illness. And you'll find our 6 chapters in San Fernando Valley, Santa Clarita Valley, San Gabriel Valley, South Bay, Glendale, Whittier, and Pomona Valley. And if you're seeking out our services elsewhere, go to NAMI.org, NAMI.org, and you can find all of our chapters. We are a support, education, and advocacy organization, and we provide various different signature programs. You don't want to do this alone. You need help, whether you're a peer or a family member and caregiver. We have a family-to-family course, which is a structured and facilitated education program for family members and caregivers. Similar program called Peer-to-Peer for people who are living with a mental illness. NAMI Basics for caregivers and friends of children and transitional age youth, and support groups for both peers and family members. So we encourage you to reach out to us. So we want to emphasize the need for our county to develop, as Dr. Sherin said, our alternative crisis response. Many calls don't require a law enforcement response, and we should remove the interaction of law enforcement in mental health crises to the greatest extent possible to keep people safe. In other words, help, not handcuffs. Far too many interactions with law enforcement often occur where people with serious mental illness come to harm. And of course, especially in light of our recent events in our country, race is always a large issue, and we know that people of color are very much so disproportionately affected. So how do we do this? There's been recent changes to our local 911 dispatch procedures, and that's a good first step. And NAMI looks forward to the full integration of the new national mental health crisis line 988, which will be integrated with our local system in around July of 2022. So you'll have, instead of the easy to remember 911, you'll have just an easy to remember number of 988. So we need to expand our existing clinical responses, like the work that Piero does, that don't involve law enforcement, such as our Department of Mental Health Psychiatric Mobile Response Team, or PMRT. We should look to utilizing any community-based organizations. People have informed me that there's quite a few CBOs out there that also do crisis response, and we should look to them and their expertise and integrate them into the system as well. Let's also remember peer support specialists are also a welcome addition to alternative crisis response efforts. People who are in crisis will be able to relate to somebody who also has a mental illness, and that should be able to help responders. Our co-response units, with Dr. D'Angelo was so involved with, such as SMART and MET, they have to be sustained and they have to be expanded. And it's incumbent upon our county and the Board of Supervisors to fully fund this. Okay, we need non-law enforcement interactions that are clinical reactions, but we sometimes also need a co-response unit where there is a law enforcement officer present and a clinician. And finally, when no other team is available and it's just law enforcement, all sworn officers and deputies should all be fully trained in crisis intervention team training and protocols and other de-escalation techniques. So the time is really now. I mean, we're really at a fork in the road, and you know, we can't kick that can down that road anymore. We have to understand that when people don't receive the level of mental health care that they need, it oftentimes leads to criminalization and victimization. And that's only going to end when we step up and fully fund all the reforms we've been working on in the ATI initiative, the Men's Central Jail Closure Work Group, the Measure J Advisory Council. NAMI is part of all of those, because we have to remember that jail is the bed that never says no. And we want our clinical services to be the bed that always says yes. And we need to give Dr. Sherin the funding he needs to build out our Department of Mental Health system. And we need to give our both community-based organizations and our clinicians who work with law enforcement fully funded, because people then will stay safe and no one will be hurt. And I thank you for having me tonight.
Thank you so much. And we're going to move on to hearing from Judy Mark. And before we do that, and I know she's been in touch with the Cervantes family, I erroneously described his name. His name is Isaias Cervantes, not Israel, and I apologize for that. Judy Mark, the floor is yours.
Thank you so much. His name is Isaias, which I know is not always easy to pronounce, but I've been saying it a lot for the last 3 weeks, and saying it in a sentence of justice for Isaias. So we will all get used to saying his name perfectly. Thank you so much for inviting me. I want to introduce myself. My name is Judy Mark. I'm the president of an organization called Disability Voices United, which is an organization founded, directed by people with developmental disabilities, such as autism, cerebral palsy, and their family members. I myself am a parent of a 24-year-old son with autism who has had behavioral crises in his life, so this is very, very personal to me. I'm also a professor at UCLA in disability studies, and I teach the history of autism as well as other classes about autism. I've also, through the Autism Society of Los Angeles, participated in trainings of thousands of police officers in the LAPD, and I produced a short documentary on the subject of training officers. So I feel like I'm coming into this with a personal and professional experience in really understanding what it means for law enforcement to be interacting with people with developmental disabilities. I should also say that that the years of experience I've had with working with the police department on their interactions has ended for me. That after this situation with Isaias 3 weeks ago, I've decided that I'm no longer going to train officers, that my collaboration has ended in that respect, and that we are only going to be looking for alternatives and really call for no interaction between police and people with developmental disabilities or mental health disabilities when they are in a crisis, because having an armed response is never a good idea. So I wanted to just tell you a little bit about what we're hearing from the family, what we're hearing is going on with Isaias Cervantes case. As many of you know, the LA County Sheriff's Department late yesterday, released the body cam video of the shooting of Isaias, but it wasn't the raw footage as we were promised. It was a highly produced, biased version that manipulates the facts to cover up what really happened. And we've heard that this is a pattern with the Sheriff's Department. The family of Isaias Cervantes is distraught, devastated, heartbroken after watching this distorted body cam video. And they are really, at this point, they weren't willing to come on and speak about it because they are so devastated and feel betrayed by what was promised from the LA County Sheriffs. If you look at the video, for those of you who have seen the way that this highly produced video plays out, you will see that there is this misleading narrative with lots of writing around it and an underlying narration. And what to me it shows is that if you just look just at the video, the body cam video in itself, you will see that it confirms that the LA County Sheriff's deputies entered Isaias's home when he was calm and posing no threat. This was not a matter of de-escalating a behavioral crisis like you've heard about. These officers actually escalated a calm situation, which ended in the senseless shooting of an unarmed deaf man with autism. And the other thing that was very strange to us is the video actually never shows the shooting. In fact, the body cameras from both officers mysteriously fell off during the shooting encounter and only captured the audio of the incident, which to me was also very odd. The video really for us raises more questions than it answers. As with George Floyd, as you saw, the police can characterize an incident in a very misleading way, and that with George Floyd, it was only the bystander, that teenager who took that video to where we saw the truth. We also saw just this week that the teenager in Ohio, Ma'Khia Bryan, who was killed by police, we saw that body cam footage released within 24 hours. They didn't wait 3 weeks like the LA County Sheriffs did in order to produce this highly edited and biased narrative that obscured the truth. So we really want you to understand how this has played out. Sheriff Villanueva claims that he promotes transparency and accountability in an agency that has been lacking in both for many years. And yet here he is doing the opposite. This little movie they created is not transparent at all. And he seems to have no interest in holding the officers accountable for their horrible act. There's more that you should know, that from the time that the officers came into their home to the time where he was shot and now paralyzed for the rest of his life, it was 30 seconds. It was 30 seconds. Any kind of training that you've seen for police officers tells them to slow down, assess the situation, make sure that you are confronting what you consider a threat, that it's actually a threat. But in 30 seconds, they had shot him from the time that they were at the doorstep of his home. And after the shooting, for no apparent reason, the officers are screaming to clear the house, clear the house, clear the house. You'll hear them screaming for no reason. And Isaias's mother couldn't even stay with her autistic and deaf son to see how he was doing and to make sure he was okay. In fact, the officers locked Isaias's mother in the back of a sheriff's vehicle and wouldn't let her go to the hospital. She couldn't even get out of the car. They drove her to the sheriff's station, and they kept her locked there all night as if she were a suspect, as if she had done something wrong, as if she were a criminal. And to make matters worse, Isaias has a twin brother who has cerebral palsy and is paraplegic. He was in the next room in a wheelchair. They cleared out the entire house but left him in there alone, having heard his brother shot by the sheriffs. After the shooting, there were dozens of officers who showed up. They were laughing outside the house, according to the family, as if this was some sort of funny event that had just happened. And it didn't end there. The family reports that sheriff's deputies would not let the family visit Isaias in the ICU. It took a lawyer to force them to allow the visit. In addition, the sheriffs continue to intimidate and harass the family repeatedly. They have repeatedly pulled one of their vehicles into the driveway of the family home and just sit there. They also are showing up at the hospital for no reason. And they actually have had the audacity to say a few days ago, oh, we thought he was dead. We didn't even know he was still alive. This shows the callousness that is endemic in the sheriff's department needs to be addressed. Not just the shooting, but the events surrounding it and after it. From the deputies who committed this atrocious act of almost murdering Isaias, the gun placed in his back, shattering his spine into his lungs, which is leaving him paralyzed, to the officers who laughed about it outside, to the officers who continue to intimidate, to Sheriff Villanueva himself, who seems to be stage managing this cover-up. It runs deep, and it is incumbent upon this Oversight Commission to investigate and hold the individuals accountable. It is not, though, let me say, just the sheriffs who are responsible and who are culpable here. The system failed Isaias at every level, and we are planning to hold other parties responsible. In Isaias's home that night was a regional center funded behavioral interventionist who works for a crisis agency that states on its website that its philosophy is to prevent interactions with law enforcement. And yet she did not prevent law enforcement from coming in that home. We're witnessing a collapse of the systems. We know people with NAMI feel the same way, that the entire system is failing people with disabilities. And we need a thorough investigation. After the George Floyd verdict, Sheriff Villanueva issued a statement this week that said, if a crime is committed, regardless of who the perpetrator is, they will be brought to justice. Victims will always matter. Transparency and accountability work both ways. When a law enforcement officer crosses the line from protector to oppressor, they must be held accountable. Clearly, the sheriff only means that when it's not one of his own deputies. And if the sheriff wants to keep any semblance of trust in the community, he should investigate the deputies that paralyzed an unarmed, autistic, and deaf man who was calm and sitting on his couch and work to hold them accountable. Your mission is to help us investigate this and to find out the names of these deputies and ensure they are not still out on the street or getting paid. As I've said, I know now that no matter how much training you provide, armed police officers are the wrong response for people with disabilities in crisis. There are alternatives, as you've been hearing. I also support Assembly Bill 118, sponsored by Senator Sidney Kamlager, which creates these community-based organizations as a crisis response, as an alternative response for specified vulnerable populations, such as people with disabilities. So I just want to say in closing that Isaias is still fighting for his life. He just got out of the ICU. We offer our prayers and our support for the Cervantes family, who is still not being supported. They are still being intimidated. And we are hoping that Isaias can heal quickly. We know that he's very traumatized by what has happened, and he sees himself. He actually said, I see myself as another George Floyd. So thank you very much, and I'm happy to take any questions.
Judy, we could spend hours talking about every step along the way here. It is, I mean, as you probably know, the releasing body cam footage is supposed to be the raw footage, not something that is stage managed. Has the sheriff responded at all to say why he's not releasing the raw footage?
Not to my knowledge, not yet. They just released it at 3 p.m. yesterday, and we know that some media have been asking for a statement, and we haven't heard any response yet.
All right. Well, that will be subject for some discussion after we hear from public comment. And again, let me try and pronounce his name correctly. Isaias.
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 Yes.
All right. Thank you. I will repeat it so I get that correctly. So now we're going to open this up to live comments and questions from community members, and then we'll circle back and see if there are any particular issues, discussion among the panelists, or things raised by the community members. Jennifer and Ingrid, do you want to go ahead and start the public comment? Thank you.
Will do. And we do have 16 individuals who have signed up and are logged in. For everyone who is on and would like to make a comment, please go to your participant window and click on the small hand icon. When it is shaded in gray, that means that your hand is raised and I will be able to see you to unmute you so that you can make your comments. Also, if you send a chat to me, I am able to see it, but I will not be able to respond to your chat, but I will make sure that you're added to the list. And before we have our first speaker, we have one announcement in Spanish.
Buenas tardes. Si necesita una traducción de su comentario público de español a inglés, por favor diga la palabra español antes de empezar a hablar, y un traductor le dará instrucciones y traducirá sus comentarios cuando termine de hablar. Gracias.
Thank you. And our first comment will come from Kate Movius. Kate, it looks actually like I'm unable to mute you. If we could check your audio connections, I'll work with you offline on that. The next speaker will be Sean Herman. Sean, you are unmuted. Please go ahead with your comment.
Hi, can you hear me?
Yes, we do. Please go
okay,
ahead, and you
okay.
have 3 minutes.
I have 2 sons who are on the spectrum, and I'm attending with my youngest who's here with me. My concern, and I appreciate all of your input, and I'm very happy to hear that there is concern about people with developmental issues and challenges. My sons are both high functioning, and my biggest concern is for my youngest right now, based on the Elijah McClain issue, where you have this really sweet, very quiet, very clearly to me neuroatypical kind of individual who was just walking home with a hood on and, you know, his face covered because he was freezing. My youngest walks around like that a lot. And, you know, he gets stopped on the street and, you know what happens. Now, my son is not a person of color. That, you know, not that that shouldn't matter, but probably does. But I'm wondering, and actually, you know, because I'm terrified that selective mutism will kick in and he wouldn't be able to speak for himself. Is there any kind of identification one could carry or some way for people who can't really always speak up for themselves or advocate for themselves to provide to law enforcement, or that law enforcement could ask for or look for in a situation where maybe a person isn't able to react as, you know, or process as a neurotypical person might be able to?
Ms. Herman, that is a great question. I don't know the answer to that. I don't know if any of our panelists do. If you want to just respond briefly.
This is Judy Mark from Disability Voices United, and I can tell you what our position is on that. I mean, many families make the choice of registering their autistic child with the local police department or putting some sort of identification bracelet. We feel that that could be problematic and stigmatize that individual. And, you know, especially if that individual is not making that choice of self-identifying to the local police department, we haven't seen it necessarily as reducing violence.
Okay. Yeah, I would have to agree with you. It just, there has to be something. I mean, you know, it's just terrifying.
Do Dr. Sherin, Mark, either of you have any thoughts on this subject really quickly?
You know, for NAMI, we have always suggested to parents, and of course, we're not dealing with developmental disabilities, we're dealing with serious mental illness. But we think it is beneficial to contact the local precinct, you know, whoever's going to respond to your home, should you call, and at least let them know to put a note in the computer that there is somebody there with a serious mental illness. So if there is a 5150 call, and then we instruct them when they dial 911 to make sure they know this is not a criminal call, it's a mental health crisis call. So at least that way the officers know that somebody with mental illness lives there when they show up.
Yeah, I'm not, sorry, there's a noisy dog next door. It's not a mental illness issue though. It's just, you know, it's a developmental thing. And I don't know how to really address that. I agree with the stigmatization thing. I just didn't know if there was something as an alternative in place, or maybe could be in place.
May I ask a question?
Go ahead.
I'm just wondering, the selective mutism, is it related to anxiety? And
Anxiety, yeah, he's you know, multiple diagnoses, ADHD, anxiety disorder, autism, you know, it all combines and it manifests. But the selective mutism is what concerns me in kind of a police interaction kind of situation.
Well, so I'm going to come from a biased angle in terms of desensitizing somebody. If indeed it would help with allowing your son to have some neutral interactions and or positive interactions, maybe should there be a time and proactively do so, then when there's a time that he may be involved in an unsolicited situation, perhaps that desensitization may go to his advantage, and the selective mutism may not be as prevalent. Just a thought.
So take him to the police station or something, introduce him around, or
something. Yeah, whatever he would feel comfortable with. I mean, you know, your son, where his thresholds that would allow him to remain within his comfort zone, but yet allow for some growth and expansion of.
functioning.
Thank you.
It's just, you know, in situations that are, you know, not familiar or very scary or uncomfortable.
Sure.
I mean, we all get scared and quiet, but you know.
All right, I think we're unfortunately we're going to move on.
Thank you everybody for your input. I appreciate it.
Yes, and just an announcement for any of the speakers or any of the attendees, you can also go to coc.lacounty.gov and email your questions to the Civilian Oversight Commission, and we'll do our best to forward those to the appropriate panelist as well. The next speaker will be Cynthia Anderson Barker. You're unmuted. Cynthia, please go ahead with your comment.
Thank you very much. Can you hear me?
Yes, we can. Please go ahead.
So
Yes,
I'm
3
an
minutes.
attorney. I'm a civil rights attorney. I work with the Lawyers Guild, and I'm working with a coalition called the Check the Sheriff Coalition. And we've been focusing on law enforcement encounters with folks with mental health challenges. And this issue came to my attention when a young man named Eric Briseño was in his room. He was having a mental health episode. His mother called the police, the sheriffs. Well, she actually called 911, and the Met team didn't come, but the sheriffs arrived at the door. Meanwhile, he'd fallen asleep. He was in his bedroom. And the sheriffs barged into the house. They barged into his room. They pushed past the mother, and he ended up being killed. He was just brutally, he was beaten up. And how can anyone explain this? Well, the mom was at the door. She watched what happened go down. But what the police did, and there's a similar pattern here, is they then took the mother out of the room, put her in one police car, the father in another police car, kept them sequestered. He, meanwhile, he's dying, right? And then he dies. And then they proceed to ransack the house. What they were doing was looking for evidence of a crime, so they could blame the victim for the death. And I see our panelist is shaking her head yes. So the sequestering of the parents, the searching the house to blame the victim to find the evidence, it's a travesty. And so we can talk and talk forever. We know there is a problem with the sheriff's department and how they handle mental health calls. They should not be at all involved in handling any mental health call. There has to be a separate process for dealing with this. But they also have to be held accountable for these deaths and this treatment. And I know the COC has no power. I hope Max Huntsman can jump in and subpoena the sheriff and get him to do something. The department has to be reined in. And Sheriff Nueva is not acknowledging any of these travesties of justice. Think of the suffering of these parents. That's all I have to say. Thank you.
Thank you. And the next comment will come from Shara Darden. Shara, you are unmuted. Please go ahead with your comment.
Hi, thank you for having this town hall event. Thank you to the panelists for being here. I am a Black woman. I have an 18-year-old autistic son and an 11-year-old daughter with an anxiety disorder. Every time I see a police officer abusing their position of authority and harming people of color, I see my children, my family, my friends, and even my own life at the mercy of an abuser with a badge. Every day we are watching and experiencing the trauma of seeing Black bodies, Black people, Black children being violently removed from this life by those sworn to serve and protect them. I know we are here today to discuss police interactions with people who have mental health conditions or developmental disabilities, but I am unable to untangle those conditions from the condition of being Black. Being Black is the first condition that an officer will notice about my autistic son or my panic-stricken daughter, should they ever be approached. And so intersectionality is important to recognize and address. Last month, LASD officers beat and choked a mentally ill Black man in Santa Clarita. His name is Rashad Singletary. The violent interaction was caught on camera, and within hours, LASD had released a statement citing that the young man was uncooperative and use of force occurred. I'm noticing a trend here. LASD's statement went on to connect this young man with an armed robbery and later references a simulated gun. What does that even mean? This type of one-sided, self-serving, defamatory statement only further serves to create a chasm of mistrust between LASD and the communities they serve. The altercation, turns out, was due to a misunderstanding with a postal worker over a package. This 23-year-old mentally ill Black young man was beaten by 2 LASD officers and then charged with 2 counts of resisting arrest for his trouble. I hope that this commission will take a look at that video and look into this. I have 4 requests. Prioritize body cameras in Santa Clarita. We have been told LASD will move to their new sheriff station and will implement body cameras, but we haven't been given a timeline for the rollout. It needs to be prioritized and communicated to the community. We need mental health professionals to respond.
Thank you. And Shara, that does conclude your time, but if you'd like to put the rest of your comments in an email and send them to cocnotify@coc.lacounty.gov, we'll be sure to distribute them.
Thank you.
Thank you. And the next speaker is Kate Movius. Kate, you are unmuted now. Please go ahead with your comment.
Hi, Jennifer. Can you hear me now?
Yes, we do. Please go ahead.
Okay. Thank you, everyone, for being here. I appreciate it. My name is Kate Movius, and I have a 20-year-old son with nonverbal autism who's had many encounters with the LAPD over the years. And for that reason, I created a training, and I currently work within the Sheriff's Department. We've trained about 700 deputies in the last 5 or 6 years. And I'm here to say that training works. However, we don't have enough deputies trained. And I also agree with what has been said about the need for Health and Human Services resources and the expansion of receiving and treatment facilities as well. These things are absolutely crucial for the most vulnerable members of our community. What I would like to say, and I know we have a long line of people wanting to speak, is just a few things. One, we need more deputies trained. We need the training to become mandatory, and we especially need patrol and dispatch to be trained. It seems to me in this tragic incident that occurred a few weeks ago that we had some missteps perhaps early on. We need dispatch trained, and we need deputies, patrol deputies especially, trained. Right now, my training is optional, and specialized training is crucial. Secondly, we need our MET team to be fully supported, and I'm echoing, I think, what either John, Sherin, or Mark Gale said, that the MET team is currently operating at 55% of their capacity. They're stretched extremely thin. From what you heard from Dr. Dengillo, the work they do is, again, highly trained and very targeted to achieve peaceful outcomes. But we need that department to be recognized and trained. And I would implore the Board of Supervisors to really take a look at that issue and take a look at creating a more robust funding and personnel boost for that department. And finally, I just want to again echo what John Sherin said about the importance of facilities. In my particular community, which is a microcosm within the autism community, which is the severe individuals with autism, we don't have anywhere to bring our children or our loved ones when they are in crisis. They end up in emergency rooms. They end up in absolutely inappropriate settings. And this is a crisis, I'm sure, along with many other crises we have in health and human services. So I would be very interested in exploring the expansion of those specialized trainings designed for those with disabilities, not just for those who are experiencing other types of mental crises, but those who have alternative forms of communication, for example. I will say, I'm going to end just on a slightly positive note because this is a very somber evening, as it should be, which is that we've heard many, many saves and many success stories from the training. So I just want to end with that, and I thank you all for being here.
Thank you. And the next comment will come from
Is it
Angela.
Okay can I just make a comment there? Because I've done a lot of training as well, not with the sheriffs, but with the LAPD and TSA agents and the LA Unified School District Police Department. You know, and to comment on the previous speaker who was so salient, and I would love to meet you and work with you as the parent of a son with autism, is that, you know, we have to talk about the intersection of race and disability here, that it is not just about, you know, great, we're going to train these guys and they're going to show up. There is an intense fear of police, regardless of whether you have a disability, if you are a person of color. And if you look at the raw footage of what happened to Isaias, his mother actually tells the police officer, he is scared of you, he believes you are evil and that you're going to hurt him. And 30 seconds later, he is shot and paralyzed and almost killed. And so we cannot have armed officers entering the homes at all, whether they're a MET team, whether they're the MEU at LAPD. If there are armed officers, we have the chance of this ending very, very badly. And we have to find another way. And that is not more training. That is providing community-based organizations that people have a trust in to have the ability to answer in the time of crisis.
Thank you for that, Judy. And the next comment will come from Angela Chung. Angela, you're unmuted. Please go ahead.
Hi, good evening. Thank you so much for taking the time to really address this important issue. I'm a policy researcher and also an attorney. I also spent time being a Los Angeles Public County public defender for many years. I think that this is really important. And I think one of the things that I have a question on is infrastructure. I do know that there's a federal bill right now that was passed to put forth 988 as a number. The gentleman from NAMI who was sharing that. I'm just curious what kind of coordination is happening on the state and county level regarding that. If speakers could say more about that.
Yeah, I could jump in on that. The answer is absolutely. And 988 will hopefully become a part of our culture. I would have preferred 922, but so be it. And what we're doing in that alternate crisis response work across the county is trying to figure out how to coordinate what is a very chaotic set of call centers. So we're in the process right now of doing some consolidation, including the ability for more crosstalk. We have a pilot right now with the sheriff, where the sheriff can come straight to us to dispatch mental health teams. But 988, I think, is a big step forward, and it will allow for a very simple way to have the community reach straight into the health and human service arena. And you can imagine that the communication between 988 and 911 is going to be paramount. We, the County of Los Angeles, and my department, were sponsors of a bill, and I believe it's actually maybe SB 988. I'm not 100% sure. That looks to, and we did that along with the Steinberg Institute and the Kennedy Forum at the federal and state level to advocate for a statewide implementation of 988 in a very coordinated and robust way, and that also brings funding into the county to support the infrastructure.
Can I use some of my time to follow up too with a clarifying question? Oh, did I interrupt somebody?
Yeah, please go ahead. You can go ahead and finish. We'll just keep the timer going, and if they're able to
Thanks, I
respond, they will.
appreciate it. Yeah, how does that work with 211, and how will that infrastructure support groups that don't want a co-response model, especially for particular scenarios that they don't want de-escalation? Just by having police there escalates the situation.
Well,
So-
you know, yeah, I mean, I'm being trying to be respectful of your time. 211 really is an INR, an information and referral service. It's really critical that 211, like all these other call lines, be coordinated, and that we figure out algorithms so that requests and needs are triaged to the people who can make an assessment and dispatch a team. The idea with 988 is actually to avoid law enforcement being dispatched at all. I'd like to think that as we are able to respond more, I mean, it's come up again and again, you know, you call PMRT, you might get a response in an hour, 2 hours, 3 hours. You call law enforcement, you're going to get a response more quickly. That's just a capacity issue, and it's a part of the way that we, frankly, our you know, Western culture has dealt with crises. We've put that on the backs of law enforcement instead of recognizing that so much of the demand is actually care oriented, and we have to leverage the fact that we now know public health is public safety.
Thank you.
Thank you. And the next comment will come from Aaliyah Valdez. Please go ahead with your comment, Aaliyah.
Hi, can you guys hear me?
Yep, we can. Please go ahead. You have 3 minutes.
Hi. So first of all, I want to uplift all the efforts to alternative solutions to crisis response. But while we wait for those solutions to be fully implemented, I want to emphasize that all patrol deputies are in great need of effective mental health training, because whatever training they received at the academy is not enough, and it's clear that it isn't. Annual mental health training should be mandatory for all patrol deputies and deputies in jails. If the county can require their employees to take mandatory trainings, this type of training that could save lives should have been implemented yesterday. Thank you for all your efforts, and I yield the rest of my time.
Thank you for that comment. And the next comment will come from Maricel Rams. You are unmuted. Please go ahead with your comment, Maricel.
Hi, yes, thank you for having me. So I just wanted to address something for, you know, people that have been wrapped in the system, you know, like ex-parolees or people that have been on probation, felons, you know, when they're known people, you know, the sheriff's department, I just wanted to let you guys know that in Palmdale, sheriff's department, they're hunting people. They stay in lower classes of the area on purpose, and homeless people that are in the hotels, they come by like every 5 minutes harassing people. And I myself currently have an issue with the sheriff that's out here, and I've even talked to the DOJ about it. And you know, he left a number in my property, and we have been texting back and forth. And they have something called a give up 3 go free over here in Palmdale. You give up 3 names, then they'll let you go free, and if not, they're going to take your son away, because they do talk to DCFS. That's another party that needs to be looked on. But anyways, so that, and that we're threatened with our kids. They come harassing. What Miss Mark was saying is true. You know, they come harassing, and if you don't do what they tell them, you're threatened, and he's called me names. You know, there's a lot of issues that are deep within that, you know, the power, there's something going on. So I'll donate the rest of my time. Thank you very much.
Thank you for that comment. As a reminder, if people would like to make a comment, please be sure to raise your hand. If there is messages sent to the chat, those don't go anyplace. So please raise your hand or send an email to the COC. And the next comment will come from Lourdes Gomez. Lourdes, please go ahead with your comment.
I fully support what Judy Mark said and share. I fully believe her experience, it reflects my experience. My child, at the age of 13, nobody had identified his disability. and they called it mental health. He was taken by the police officer, not once, not two, not 3 times, no 4, 5, 6, 7, 8, 9, 10, 27 times, because he was asking for help. He was autistic. We found out a month away from being 15 years old. For 2.5 years, the school district made an intense, horrible experience for my child. The police handcuffed him, not outside the school. That wasn't a good day when the police was nice. Some days, in front of his peers, in front of his friends. That created bullying, trauma, and it created a deep, profound disrespect to authorities. I'm asking here because I don't know what else. I've been getting hundreds of hours to become an advocate. I'm an independent facilitator. I'm learning so much, but yet I cannot always be with my child. And I'm asking here to make society safe for him. He deserved it, but he's a minority. Not only he is Hispanic like me, he's transgender, and he has autism. Honestly, I want him to live. I've been fighting tooth and nail. The system was, oh, he's coming here too often for hospitalizations. The police is spending so much time bringing your child to the hospital. It is best for him to be hospitalized permanently. That is not fair, and it was not right. I had to advocate. I had to literally be borderline homeless to provide the help my child needs. I had to go into financial distress, not that distress, because I was losing hours of work to be able to advocate for my child, to look for resources. Please, you have power, authorities, titles. I am just a mom who's looking out to get the services my child needs. Please make this system work for him. He deserves it. He's an incredibly brilliant, amazing individual who deserves not to be pointed out, not to be told that he will spend his life in prison. Well, a hospital. Please don't do that to people. We deserve our families to be part of society. Please do something. Be the change our families need. I can only advocate so much. I am tired and exhausted. Do something for my family. Do something for every community that is asking you to help. Please do something. We need it.
Thank you, Lourdes, for your comment. And someone from the Civilian Oversight Commission will be following up with you.
Jennifer, it's John. I'm sorry to interrupt.
Please go ahead.
And I'm assuming that you were told that I had to take off at 6:30, right?
Yes.
You know that.
Yes, we are aware.
But I can't. I do have a few things I'd like to share.
Please do.
Well, I really appreciate the comments of the last caller, and I will say that we don't have inclusive communities at all, and we don't really embrace people who have what we call disabilities as a part of our fabric. And that's a huge, huge problem, and it's something that we need to fix. Along those lines, I think the importance of lived experience is massive. There's another bill, SB 803, which we also sponsored, and we got through, and we got signed last year by Governor Newsom after 3 years of getting turned back, that allows us to collect Medicaid for peer services. And we're trying to define what peer means, because it needs to be a broad definition, in my opinion. But peers have to inform what we're doing when we talk about the regional call centers and understanding what's going on in triaging. Peers have to be a part of the response in the community, and peers have to be at the receiving facilities. Peers could be involved in doing the training that we're talking about across the board, including with law enforcement. And on that note, communication is an issue. We talked about mutism. I would also say psychosis, intoxication, just language barriers. You can't actually engage someone if you can't communicate with them. So that has to be a part of our culture, is to insist that you're communicating with someone if you're going to be engaging them. And in the issue of engagement, I would ask, we have this saying in the medical field, do no harm. So when we call And, what does a parent want? What does a family want? We've brought up a couple scenarios here where I don't think there would be a situation that would be considered kind of a life or death scenario. And we have to figure out, this is a part of empowering communities to be the solutions to their challenges and not having to require outside intervention. So I would say we have to really think about how that plays into these scenarios. In the one case, this is an individual that is autistic and has is deaf. There was the communication didn't occur. At least what I saw was in English. And then kind of why are we entering homes? Is that something that the family would want, or is it not something that the family would want? So we have to really take a step back from the way we've done things. And I'll tell you straight up, the systems are broken. My department's broken. I got hired to come in and try and move things, and that's all I'm trying to do every day. But we have a long, long way to go. And we do need not just more coordinated systems to collect the needs from the community. We need, I'm going to say, at least a quadrupling of our response capacity. And I would say that the vast majority of law enforcement entirely agrees. There's 100 teams right now, we need at least 400. And then in terms of beds, we talk about receiving facilities. We did a study, and anyone should look at it, it's public record. We're about 4,000 treatment beds short in Los Angeles County, and we have about 4,000 beds. So that means we literally need to double the capacity of treatment beds, and not just for people with mental illness, people with addictions, and other people who have behavioral health challenges, regardless of what they are and why they have them. And get the state, the federal government to not restrict the way that we pay for things based on some diagnosis and some medical necessity definition that doesn't translate in the trench. So I really appreciate you giving me a little bit of time. I wish I could stay longer. I have another set of meetings.
Thank you.
Thank you, Dr. Sherin, very much, as always. And we look forward to working with you and your team and try and come up with some alternative methods. So thanks very much for being with us. Jennifer, you want to take some more public comments, please?
Sure. And the next comment will come from Estella Acuna. Estella, you are unmuted. Please go ahead with your comment. Estella Acuna, you are unmuted. Would you like to make a comment?
Yes, I just want to ask if there can be some training developed around foster youth and how our residential facilities respond to crises and what the protocols they should do as far as engagement with law enforcement. That's it.
Okay, thank you. And I'm not sure if any of the panelists want to jump in on that or if we should move to the next speaker.
I'll just say, once again, whether it's a foster youth, whether it's a person living with their family, once again, I'm going to say that no matter how much training you do, if you have an armed person walking into that situation, they're going to escalate it and not de-escalate it. And so it's really quite problematic that we keep knee-jerk reacting by saying training, when in fact what we should be saying is alternatives, that there has to be another way, and that we have to accept that there are people in the community who do not trust the police. We're seeing this around the country. So for us to go back to the same old answer, I've been working on training with the LAPD for over a decade. It didn't work. It doesn't work. I feel that I can speak to this out of experience because I've been there. I met some extraordinary police officers at the LAPD, very, very committed. But that doesn't mean that it works to put an armed officer in the middle of a mental health crisis or with a person with a developmental disability who may not be able to react quickly in the way that an officer expects them to. I mean, if you look at the raw videotape of what happened to Isaias, they knew, they were told in advance exactly what happened, why he was upset. He was upset because he couldn't buy a snack. Now that should be like ding, ding, ding in the mind of an officer to say, this is obviously a 25-year-old who is not typical, who is not neurotypical if he could be upset about a snack. And so they should have been coming in, or first of all, they shouldn't have come in at all. They should have, they heard that he was fine and they should have just left. Why did they engage? We just don't understand this. And in most cases, we don't understand why they engage when you take a situation where everybody's calm, where that man was asleep in his bed. It doesn't matter how much training you do, because you have guys with guns and they want to use them.
May I offer another perspective on training? So, and Judy, I don't disagree with what you're saying. There's so many instances where somebody who's armed goes into a situation and there really isn't any need for somebody to be armed to be there. And in those instances, we need our Department of Mental Health clinicians and other alternative crisis response. The problem is we just don't have it. And so NAMI got involved with CIT training back in 1988 when a person with mental illness was killed by the Memphis Police Department, and Major Sam Cochran and NAMI Memphis and the University of Memphis formed the gold star curriculum of crisis intervention team, the 40-hour training, which everything is sort of based on. But, you know, the situation that I think is important to realize is just because we want something to be so doesn't mean you can't train somebody, for lack of a better term, if they're going to go rogue or their personality is going to go rogue. Training's not going to stop that. But if you have an officer comes across a situation and there is no team and there is no mental health clinician, and that officer or deputy is the only one there at the scene, and it's my kid, I would rather have a trained officer than an untrained officer. So NAMI, we actually train our presenters. We are part of crisis intervention team training for the Sheriff's Department, for both custody at the jail and for patrol. And we do 2 hours, and we come in, and Judy, you're familiar with it because you've done training yourself, and I know Kate Movius is. And we're sort of the human face of mental illness. And we know that we change hearts and minds. Do we change the behavior of every officer or deputy in the room? No. But we know we change them a lot because they come up to us and they tell us so. And many of them also have family members who have serious mental illness and want to reach out to us as an organization to get help personally. So I'm always going to be a proponent of training and alternative crisis response, but we've got to fund it, and that's really up to the Board of Supervisors to make sure the money is there, so officers show up less, and alternative crisis response should be the default. Thanks for the time.
So, Mark, I just want to respond because I actually so respect the work of NAMI, and here's the training that I support and that we are going to engage in in the future. Disability Voices United is about to embark on a training for family members of people with developmental disabilities like autism called Don't Call the Police. It's basically saying that if your child, if your family member is in a mental health crisis, here are alternative phone numbers you can call. Here are community-based organizations that are available to you. Because when you call the police, you are putting your child at risk. And that is the training that I'm embarking in, not the training that I've been doing, which is of the police officers themselves.
Thank you for that, Judy. That sounds, I want to follow up on that in the future. But I do want to get back to public comment. Jennifer, you want to take the next one, please?
Sure, and the next comment will come from Adam Darvish. Adam, you are unmuted. Please go ahead.
Oh, thank you so much. I just wanted to thank you for this webinar or the virtual meeting that you all have put together. Great work that is in the background that I was not aware of. I'm a resident in the city of West Hollywood, a healthcare professional for 30 years. The company that I work with also has a behavioral health psych hospitals around the country. I am also a board member in Sacramento at our California Hospital Association, executive board member, and I can tell you that behavioral health and mentally disabled population and what we have today for them is not meeting the needs, as I was mentioned several times today, that the funding and the advocacy has been there and we're trying to get there. Our governor is focused and he understands that there's a need. Dr. Gale in Sacramento, our Secretary of Health, also understands, and he has a mission to accomplish that. It just takes a lot of money and funding. So hopefully that will be resolved soon. Today is hard to place any of those the population that needs that care, even if MET and the police identify them. But besides that, I wanted to make a comment about training and what the police should be trained on. I totally agree with the UCLA professional that mentioned you can train once and just label that officer that's been trained. That's not adequate. In healthcare, our professionals are dealing with that population daily, and even then they make mistakes and they face situations that they can't handle. So training doesn't do it. It has to be someone that's in that profession, maybe has a dual responsibility, a police officer and a professional in mental health or physically disabled population that could respond and care for them. But you can't have every officer trained and expect that they will follow that, because they're not dealing with it on a daily basis. They're not responding. I have observed the MET team at the city of West Hollywood. I was impressed with them, but that was just the sort of the touching the surface. They responded to a homeless person on the sidewalk. They did a good job, and that's what they do day over day. And that's the model that I think the police department should have, but also the families need to be educated more on how to communicate, what should we do to identify that population at home or wherever institutions. So if the police response, they know right offhand. In healthcare, we do have that for patients. We have color codes, we have signs on the doors, we have several ways of identifying the patient's needs. And I think in this case, we're lacking all of that. So that's all I had to say. And thank you so much for the great work that you do.
Thank you for your comments, Adam. And the next comment will come from Susie Pittman. Susie, you're unmuted. Please go ahead with your comment.
Hi, thank you for doing this. Everything I thought of saying has been said. I think that, the key crux of what I would like to say is that you cannot disentangle race from this discussion, and we need to keep that center. People who are in favor of training the LAPD or the sheriff's department or any police department for that matter, we have seen time and time and time again that training is there when they want it to be there. We have seen them de-escalate very critical, dangerous situations when they want to. They are trained. They just aren't using it when it comes to Black and brown bodies. And every time I think I have something I want to say, Judy Marks has said it. She's a badass, and thank you.
Thank you for your comments, Susie. And we'll move on to the next speaker, Fernando Gomez. You're unmuted. Please go ahead with your comments, Fernando.
Well, Susie just said exactly what I was going to say, but in reality, what we're saying is that as a parent of a 14-year-old young man with Down syndrome, and as a co-founder of the Integrated Community Collaborative, we're composed of over 1,200 families of individuals who are part of the IDD community. I get the argument about training, and absolutely there is a need for training, but training at this point where we're at today is a Band-Aid on a dam that has cracks all over it and it's about to burst. When I'm hearing the stories, especially from the attorney with the Sheriff Coalition, when I see and hear what happened to our friend Isaiah Cervantes, when he's sitting in his living room and he's now fighting for his life, paralyzed from the down, something fundamentally has to happen that's different, that goes beyond training. And as Dr. Sherin was sharing, we do not live in inclusive communities. And I believe the system has to be shot. I think we have to look beyond the band-aids and looking at things like qualified immunity for our community. When the law enforcement comes to our house for whatever the reason, that qualified immunity should be off the table. Things of that nature that define something profoundly different so that we don't put any of our children in harm's way. As a father, I'm petrified. I know the risk that my son, as a Latino young man, has when he goes out into communities, but what can I do when they come into your own home? The only thing that we're doing, and we're telling all our families, the last thing to do when your child needs to be regulated is to call law enforcement, because they're not there to help you. As a matter of fact, it's probably the worst thing you can do because of the chances of your child ending up not dead in the hospital fighting for his life. So here's a solution. We have to help you help us. Community-based organizations, parent groups, we're here. We understand our community, and we have a lot of passion about what we do and how we do it. Tap into our resources, tap into our passion, tap into our energy, and we will help you make the change. So at one point, Dr. Sherin can say, we have inclusive communities and we have not to worry about law enforcement and our communities being at danger. I yield my time. Thank you.
Thank you, Fernando.
I just really want to also respond to what Fernando Gomez just said about qualified immunity. I mean, that to me is the crux of the problem here, is that if we have officers who feel that they can shoot two officers who are over 200 pounds, who can jump on top of a very thin, much shorter individual and shoot him point blank in the back of his spine and have absolutely no consequences, that is the problem. We have to change qualified immunity in the state, in this country, so that we can more easily prosecute these officers when they do bad things.
Thank you for that comment, Judy. And the next comment will come from Natalia Alvarez. You are unmuted. Please go ahead with your comment, Natalia.
Thank you so much. I work in behavioral health, and we've been discussing, these issues with my colleagues for a long time. And I have a question. My question is to Judy. Given your extensive experience and as a mother of a person with disabilities, as a person who has tried to work with law enforcement, but has seen that that hasn't really helped, now we're talking about this phone number 988. What would be, in the case of Isaias, what would you think that the ideal response should have been? Imagine it's 2022 and we already have this number, and the mom calls this number instead of calling 911, and they arrive. What would the team look like, and what would they do?
I thank you for that question. Here's what I imagine we should have in our world, in the developmental disability world. And I know that there needs to be an equally trained group of professionals in the mental health world. Because let's remember that autism is different than mental health disabilities. It doesn't mean that people with autism don't also have a mental health disability, but many people with autism also are non-speaking, or maybe they use alternatives ways to communicate. In the case of Isaias, he was also deaf. So you're talking about multiple disabilities here. And so I think that in my head, the way it should look is that if you're dialing 988, that they should be looking at who is it that understands this particular issue. They should be asking the right questions. Tell us, what disabilities does your son have or your brother have? What are his needs right now? Would it be helpful to have a mental health professional come over? Would it be helpful to have an autistic, person who understands autism come over? But what you need to understand is that He had a professional in that home. There was a behaviorist in that home whose entire job it was to prevent the police and prevent interaction with law enforcement. They need to be held responsible too, because your taxpayer dollars were paying for them as well as for the sheriff. So this is a confluence of things that have gone wrong for this young man. And the family is being blamed here. The family is being treated like criminals. And instead we have to say, who is ultimately responsible here? In these family, they're doing their best. They have 2 sons with significant disabilities, and they are doing their best. But the community that is supposed to be supporting them, those professionals who get paid a hell of a lot of money to do it, they're not doing their job.
Exactly. Thank you for those comments. The next comment will come from Nelmonica Jones. You are unmuted. Please go ahead with your comment, Nelmonica.
Hi, my name's Monica, and I am a parent with a child with a developmental disability and also with some medical issues as well. I have 2 family members that have had multiple interactions with LAPD and with the sheriff department. All of those incidences, they were abused by those departments. I am a woman of color, and I have my family has been abused by multiple systems, not just LAPD, but by the Department of Social Services, by Department of Children and Family Services, by Regional Center, by, multiple services that our tax dollars abused, by Health and Human Services. We are the African American community specifically, but also all communities of color are being abused by these systems, not just abused, but are being ignored by these systems that are put into place to provide services for our communities. So when you talk about putting things into play to correct one system, all of these systems need a structural overhaul to acknowledge the fact that people have a right to dictate how their lives are going to be, and that people need to be at the table, communities need to be at the table to dictate how and when and why, and every aspect of how planning these systems work, so that their community needs can be met specifically. When you talk about in this situation, when you talk about the way that this system needs, we're here to talk about how the system needs an overhaul. If you continue to fund systems that don't work, then the actual problem is the system, because they haven't worked. They have a long history of not working. And so the solution to these issues is to just allow people to have their God-given rights to freely choose the way that they're going to live, the way that they're going to be in their communities. That's a God-given right. Instead of allowing these systems to dictate the way that people live, the way that people, commune in the way that people are in their community. I'm very passionate about this, and it affects my family in every way possible. So I would love to be at that table when you guys decide to do that.
Thank you for your comment, Monica. And before we move on to the next speaker, Chair Rubin, I just wanted to make sure that you're aware we have more than 16 speakers, and I want to be conscious of everyone's time. Would it be okay to change it to 2 minutes per speaker from here on out?
I would still like to leave it with 3, but I ask the panelists to hold their comments until the end so that we get to hear from everybody who has signed up. Thanks, Jennifer.
Understood, will do. And the next comment will come from Sophia Rodriguez. Sophia, you are unmuted. Please go ahead with your comment.
Hello, can you hear me perfectly?
Yes, please go ahead.
Okay, thank you. I'm gonna just make a quick comment. I'm a high school senior and resident of Los Angeles. I'm 17 and I'll be attending Berkeley next year, studying both psychology and law. And I first wanted to thank you for holding this event because even high school students appreciate transparency from law enforcement and community organizations. I'm currently working on a high school project revolving around police accountability in Los Angeles. And my comment to all of you is that students are interested in these issues, and I encourage you to continue holding meetings like these to encourage community outreach and hopefully increase police accountability. I also encourage you to prioritize proper implementation of body cameras so that Los Angeles residents receive the transparency they deserve. Thank you.
Thank you. And the next comment will come from Shaharda Shijas. Please go ahead with your comment.
Hi, thanks for taking my call. I am very fascinated by what's being told and really appreciate everyone's input. I think it's a really incredible, differentiation between what police should be doing with people and what mental health professionals should be doing with people. And I guess one of the questions I had was really about the community. One of the speakers was talking about like a grassroots organization. I think it was Mr. Gale, supporting and providing advocacy. I think it was you that mentioned that you're looking that the community needs to be involved with, feeding or being a part of the effort to help these mentally ill people. Is that something that I was kind of misunderstanding, or is it really true that there's going to be an effort to get community members involved in the treatment process, or at least in the initial response process?
You want me to answer that real quick?
Just hold it until the end, Mark. Thank you.
Okay. And then the next comment will come from Jason Liberto. You are unmuted. Please go ahead with your comment, Jason.
Yes. Could you hear me?
Yep.
Okay. Good evening, everyone. As an auntie of a nonverbal child and a post in-home service provider working specifically with the neurodiverse community, working on such cases such as the one being discussed, after watching the footage last night via the Sheriff's Department, I seriously couldn't stop crying. Why? Because strangers entered Isaiah's home and threatened his safety, then shot him. He was calm and collected. What people fail to acknowledge is the work Isaiah has done all these years via different types of therapy to reach this level of self-control when being confronted by strangers with a gun, then touched, or as I would say, assaulted. This was all preventable, and I think we all know this. With that said, my Southeast LA community is committed to getting the culturally sensitive services we pay for via our tax dollars. We aren't stopping. We no longer want police knocking on our doors. What we do want, however, is service providers. We want our regional centers to step up and actually provide such services and show up to meetings such as this one. Where are they? We no longer want to be re-traumatized. Our families are traumatized by ICE. Families are traumatized by police and killed. And at this point, our children are at the point, a pivotal point, with that said, of endangering their own lives, such as Isaias, in staying calm when in reality, he was in danger. Thank you, Judy, for the work that you do. I respect you full-heartedly, and my Southeast community is willing and waiting in moments' notice to rise to the occasion and demand, not ask, demand the services that we deserve. Thank you.
Thank you. And the next comment will come from K.M. Vuong. You are unmuted. Please go ahead with your comment. K.M. Vuong, you are unmuted. Please go ahead. Okay, hearing nothing, we will move on to the next comment. This will come from Kevin Tawari. You are unmuted. Please go ahead. Kevin Tawari. Oh, it looks like we just lost him. Maybe he's having connectivity issues. And next, Shelley Andrews. You are unmuted. Please go ahead with your comment, Shelley. Shelley Andrews, you are unmuted. Okay, still not hearing anything. I hope it's not me. Diaka McLean, you are unmuted. Please go ahead, Diaka.
Thank you. Just for the record, it's Dika. Thank you very
Dika,
much.
please go ahead. Thank you,
No problem.
Dika.
I'm a fellow advocate. I'm so honored to be at this table. I would like to say hello to my another fellow advocate, Judy. I would just like to say, first of all, I'm being open-minded because I am a child of a policeman. So I grew up as a father as a policeman. So all police are not bad. And I want us to continue to speak that. On the other level, I feel like police are still needed, but police are needed for things like when there's shootings or we're being robbed. But when it comes to people with disabilities, I feel like Judy done gave me another perspective. I'm still gonna go here. We need the training, but when we need the training, we need to have this has to be a team effort when we're doing the training. People with disabilities need to be at the table. Not only should they be at the table, they should be making the menu. They should be coordinated what the training should look like and bring it to the police. And we should have these meetings right here, not when something happens, not when somebody gets shot. It should happen on a regular basis. It should happen once a month. But be honest with you, it should happen every day. As a person, African American, I'm not trying to be mean, but I'm not going to apologize for it either. When you turn on the TV, it is my people. It is my people that is constantly being shot to death, being killed. When is that going to stop? So I feel like with the training, the biggest issue is accountability. A policy should be in place. We have all these policies for everything else. We need to start with policies when it comes to policemen. When you hold them accountable, then maybe they will think twice about shooting somebody instead of just tasing them. I know it's about protecting and serving, but we haven't been in the protect and serve model in a long time. When are we going to go back to the protect and serve? Do we need to remind the policemen what that means? That's what it's all about. And my name is Deacon McLean. I am an advocate, but I think I might want to change it to social justice advocate now. I want to be a part of the table. I don't want to just come to the table because I'm African American. I want to be at the table. I want to be a part of the table. I want to make the menu. So anybody want to call me, know where I'm at, please invite me to be a part of the table. Anybody else to be a part of this. Thank you very much.
Thank you, Dika. And the next comment will come from Mirtha Arriaga. Mirtha, you are unmuted. Please go ahead with your comment.
Can everybody hear me?
Yes, we can. Please go ahead.
Good afternoon, all. My name is Mirtha Arriaga. I come today before you as a mother of children with special needs. I am a mother of 5 children, whom 4 of them have special needs. I might break in tears because this is heartbreaking for me. As a mother of 3 children with autism, knowing that they're not safe to walk in the community, they're not safe in school, and every day we fight the system. We fight with school district. We fight against the regional center not being able to provide services for our communities. And now we're fighting for our lives. Being Hispanic, coming from a low-income community, and having a not visible disability to the police officer's eyes should not put us in disadvantage, and it should not be us target for them to come into our home and shoot our kids. I ask you guys to please listen to our voices, listen to our families and parents. We are in pain. We want justice for Isaias. We want justice for our kids. Enough, it's enough. We need trained community members, trained staff who are able to work with our community, who are understand our children. Our children deserve to live. I come to you guys as a mother in pain. I have walked with the family of Isaias. I have walked with the community because I'm also in pain. I don't want to be Rosa. I do not want to be in her shoes. I want my children to have an opportunity of life. I want my children to have opportunity to be free in their own community. Please hear our voices. Thank you.
I just want to add that I think that somebody from the Civilian Oversight Commission will reach out to you. So thank you very much.
Thank you. And the next comment will come from Stephanie Luna. Stephanie, you are unmuted. Please go ahead.
Yes, hi. This is the aunt of Anthony Vargas, who was murdered by East Los Angeles Sheriff deputies in August of 2018. I can't express any more than I already have the importance of not having law enforcement involved when it comes to people needing help. We've been coming on these meetings for months, expressing the need for alternative resources. We've been coming on telling you guys how the deputies respond to those needing help, how they immediately unholster their guns, how they approach the individuals with aggression. Isai Cervantes is now left paralyzed because he needed help. David Ordaz Jr., Eric Briseño, Marco Vasquez Jr., Nicholas Burgos, Dennis Todd Rogers, Jasmine Ng were all killed because they called the police for help. We talk about funding the sheriffs a lot so they can get better training, but there's a big problem with that. I believe it was in 2020, there was a new training course introduced to the deputies addressing the de-escalation process. It was called ROAR. Now this stands for Respond, Observe, Assess, and React. When we see that body cam footage, we see these deputies completely disregard this so-called training and immediately escalate the situation to harm Isais. It's not a coincidence that both of these cameras went off or coincidentally got covered when the shooting took place. Unarmed health experts and trained peer responders should be the first ones to respond to calls involving mental health issues, not the LA County Sheriff's Department. There's a flyer from the Sheriff's Department mental evaluation team where they were advertising for the cognitive impairment practical application training, and the symbol they have representing the Met trainers is a handgun. Why is the icon for the Met trainers a gun? This is beyond disturbing. There are so many people who need to be held accountable for what's happened. When I hear about the sheriffs making vulgar remarks to the family and even saying that they didn't know he was alive, it's atrocious, but it's not surprising. The East Los Angeles Sheriff's Department is notorious for harassing the families of those that they've shot. It's something that should be taken serious. This family called for help and they're now forever traumatized by what happened. They're not only processing the trauma that, they just faced, but they're now facing the harassment that comes with speaking out against the injustice that comes from the Sheriff's Department. We need to do better. We need to keep our kids safe. We need to stop funding the Sheriff's Department more money for training and start investing that money into healthcare professionals who are licensed to de-escalate situations with no need to brandish a handgun. There's no more training that can be given to them while we're out here losing our babies and having them lay in hospital beds fighting for their lives, having their lives taken away. We cannot offer these deputies any more training than we've already given them. Our kids are being put at risk. We're losing our kids' lives. Our kids are being killed. Thank you.
Thank you for that comment. And just as a reminder, if you're sending chats, I am able to see them, but I'm not able to respond. So please do make sure that your hand is shaded in gray if you would like to speak. Our next speaker is Catalina Castro. You are unmuted. Please go ahead with your comment. Catalina?
Yes, can you hear me?
Yes, please go ahead.
Oh, thank you. I just got out of one of my support meeting. I'm a member for NAMI San Gabriel Valley, and my comment was, I thought about it because the instances where I had to call the police were very different. The first time it was 3 police cars, they were out with their guns drawn, and it was horrible. It was horrible. And what I hear, the police officer in charge, well, do you have your taser? Do you have this? And I thought, my God, I called because I needed help to get him, for him to get help, and they're going to kill him. And so, that's a big dilemma that we parents or, anyone has, that calling the police is the last resort. But when you do call them and you have this type of experience, you regret it so much because it's such a horrible, horrible way to see that this is how a police officer does his work. I know it's to protect and serve, but my God, you have to have compassion. And the second time it was a much better deal because this one officer, and I don't know his name, but I thank him all the time. He was patient. He took time. He talked to my son, and it was a much better outcome. So what I'm hoping for is that more MET teams or PET teams, whatever it is, a crisis intervention, because the police officers are not equipped emotionally. I mean, the compassion is just not there. And so, for us to have more confidence in our police officers, it's going to take training. It's going to take training. And if there are committees, I will be happy to serve. And like I say, I apologize for being late. I just had to go to my support meeting. And my hope is that the training, the teams, the mental evaluation teams are much more teams of that nature than just sending a police officer.
Thank you, Catalina, for your comment. And the next comment will come from Deestra Walker. You are unmuted. Please go ahead with your comment, Deestra.
Yes. My comment is that when these things been happening with other one's family, it's not right. I mean, yes, the officers should use their tasers instead of their guns. And like, when that's what they train for, use the taser instead of the gun, so everybody, so the suspect will be safe from not being harmed. Now, I heard that they did it one with people with disability. It's like they didn't care. They didn't care how old you are. They just go and when somebody calls 911 and anonymously and they get shot. So let's put you this way, like we should have our officers use their tasers instead of their guns, and everybody would be safe. It wouldn't matter what area you in. It should be. Even with your autism child, I mean, it should not happen. It should not happen. If the child have a speech problem, the officer should be trained for it to understand the autism child, even autism adult. And I have a brother has a bipolar. He's fine, and I'm hoping that he doesn't get in trouble with the law, and they think he's crazy and all that stuff. So like if it does happen, then I'm afraid it's going to happen. I have a seizure disorder, and me and my brother worry at each other. So we're hoping that this doesn't happen to anyone like us ever. So, like I said, all the officers who had tasers should use them instead of their guns. I don't want. That's why our system is all upside down and messed up. That's why.
Thank you for your comment, Deestra. And next up, we will hear from Sylvia Gonzalez Youngblood. Please go ahead with your comment, Sylvia.
Can you hear me?
Yes, please go ahead.
Hello. I'm a California Ohlone Mission Indian. I am also a mother of 4 children with specific learning disabilities. My 3 boys have autism spectrum behaviors. So my kids they're triracial, they're Native, Mexican, and Black. I am a care coordinator for an agency, and I'm also a special needs advocate. And my 30 years of experience in that came from my kids. I just want to start off by saying that, you know, my experience with my family, communities of color, they've always called the police on their loved ones. That's like a go-to thing to do when you can't deal with your family member. It's like a generational thing that we've grown up doing. My family has always done it. My uncles and aunts were always in and out of prison because of this. Cousins, same thing, till the day they died. Some, you know, got out of it, but once you're in it, you're like targeted, like one person said, they target you in the community. They know who you are. Parents need help and education with their special needs children, and laws are in place that require agencies to do that, starting with the schools, and schools are not doing that. There's education for parents, there's education for the kids, transitions, and it's not happening. And school resource officers in schools are a big issue as well. They can humiliate, target kids, and, you know, mark them as the problem kids in the school, and then they become, you know, their first instances with law enforcement. I don't think the system is necessarily broken. They're not communicating, and the people who are in those jobs are not the right people that should be there. And right now, agencies are working in silos instead of complementing each other and working together, like DCFS, Department of Social Services, the police, therapists, nonprofits, regional centers, the courts. I mean, regional centers that's an entitlement law. Those clients are entitled to services. The regional centers don't provide the service. They contract with the service providers, and they are denying clients access to those services by denying them, saying that they don't need it. And it's a shame, and parents not only fight the schools for services, they fight the regional centers for services. One thing I just want to say lastly is that with my kids and them growing up, I never put them in situations where they would not be able to handle it, like driving and things like that. I never let them drive at 16. I had them wait till they were older so that they were mature enough to do that and or handle themselves in a situation when it came about. And I think that it's all about making sure that that family foundation is strong and parents can be educated to be able to pass that on to their kids as well. So that's it.
Thank you. And the next comment will come from Christina Canarella. You are unmuted. Please go ahead with your comment.
Thank you, Jennifer, and thank you everybody for speaking. I am in full agreement with what Judy Mark said, and I want to just quickly go through a couple things. 988, that's not may not be mandated till July of 2022. We cannot wait that long. I'm a parent, a mother, like 90% of the people that are speaking tonight, parents of children who have intellectual or developmental disabilities. That is my son in the background who's 23 years old. We cannot wait another month, another week, another second. We need to figure out what to do. We have 311, we have 411. The city, maybe we look at something that the city or the county can implement right away until 988 gets finished and completed. We also, like many people have said, we cannot have one crisis person come. It needs to be a team of people. How is it legal for body camera footage to be edited? That does not seem legal to me, and I'm trying to understand how that is the case. Also, if an officer has to go to a home to assist an individual with a developmental or intellectual disability, until we can get other alternatives in place, is there something that could be mandated where they don't carry a loaded gun in? They carry a taser or something else. Like Judy mentioned, police officers often trigger and escalate the situation immediately when somebody has an intellectual or developmental disability. I also want to honor who is behind AB 988. Tawn Hall is the mother of Miles Hall. He was a 23-year-old Black man who had schizoaffective disorder and dealt with hallucinations. No criminal record. And the family had worked with the police department numerous times. She called the police thinking that it was going to be okay, everything was going to be fine. He was shot 4 times and was murdered that day. Don't forget about Miles. Lastly, we have a race issue that needs to be addressed. I am a Caucasian woman, and I am embarrassed that when I was protesting with Isaiah, there were about 5 white people there, and nobody else came to support. There are too many silos within our system. There are too many silos within the government, DDS, DHCS, DSS. There are systems that are broken, that are failing us, that are meant to serve us. There needs to be an overhaul in the systems, and there needs to be an overhaul for each one of us to look at. When we are part of a marginalized, underrepresented community, we have to come together. It is not about me, it is about we. I understand we're burned out and tired, but nothing will continue and lives will continue to be lost if we do not come together and fight and stand up. Thank you so much for your time. And I'm sorry for everybody who lost somebody.
Thank you for your comments. And the next comments will come from Andres Kwan. You are unmuted. Please go ahead, Andres. Andres Kwan, you are unmuted. Please go ahead with your comments. I'm not hearing anything there. We'll move on to Robert Hansen. Please go ahead with your comments, Robert Hansen.
Good evening, Jennifer, and thank you for hosting this great town hall meeting on law enforcement. It's been very eye-opening to see some of the stuff that's going on. I am a behavior management assistant in residential and day program facilities for persons with developmental disabilities and dual diagnosis, those who also have mental health impairments. And I often see many staff resort to the use of police assistance and law enforcement on a regular basis when levels of crisis or behavior episodes reach a point where the staff are no longer qualified, no longer trained, or no longer in the position to provide the appropriate supports that these people need in their care settings. I'd like to speak to a couple of points. One in regards to the training of law enforcement. I believe that there needs to not just be the initial, but a strong emphasis on ongoing training, and make ongoing training a mandate for all police officers. A second point, I heard a number of people bring up the possibility of tasers as a primary use versus firearms. However, I'd like to remind everybody that we recently had a situation which led to a death of Dante Wright, where the police officer mistakenly drew a firearm in place of a taser, and that was claimed to have been an accident, and that the state and the commissioner relieved her of her duties. However, I'd like to point out that the manner in which these firearms and tasers are holstered are very similar. And oftentimes, a law enforcer, a sheriff, a deputy, they will wear these on their same dominant hand side. So it's understandable to see how a mistake like that can happen. However, it did result in the loss of a life, so that type of mistake is unacceptable, regardless to whether or not we can see how it could happen. So something I believe needs to be done in respect to that. And another off-topic point that I would like to address and hopefully get some feedback from the panel on is the accessibility of the 2 leading national databases. One being the national database.
Robert, that does conclude your time.
Oh, okay.
You can feel free to send any comments to cocnotify@coc.lacounty.gov, and our team will do their best to get back to you.
Perfect.
The next comment will come from Darren Lemon. Please go ahead with your comments, Darren.
Hi, team, and hi, panel. Little nervous having the entire 3-minute in front of my face, but I wanted to talk a little bit about with Judy. There's another article, there's another great documentary out there called Don't Shoot, I'm Disabled. I don't know if you've seen that one, but I love the Don't Call the Police initiative. That sounds like it'll be right along the lines of that. One of the officers is quoted after he shot a girl to death in the expose or in the documentary. He said, "It's my job to come home to my family." And I thought that was really, really impactful, that it's not necessarily protecting, you know, those out there with mental illness or that they're coming into a crisis. He said, "It is my job to come home to my family at the end of the day." That's in the, you know, Don't Shoot, I'm Disabled documentary. It's by the BBC. But also want to take a look at how behavior analysis might play a part in the trainings that are already out there. I know that we have empirically based and evidence-based practices. Autism is seemingly one of the hot topics in tonight's discussions. But I wanted to ask the panel, you know, I know you guys won't address it, but I'm at 7:30 already. If there is any type of hope or seeking for looking at what applied behavior analysis is able to help out with autism inside the families' homes and working in the community, as Rob was saying, at the day programs, in the group homes. Could there be something in that realm that speaks to what you're talking about, Judy, with the don't call the police, maybe call a behavior analyst? You know, I don't know if that is part of the solution, but I just wanted to see if that was something that was in the play, and I'll give up the rest of my 1 minute.
Thank you. And the next comments will come from James Sota. James, please go ahead with your comment.
Hello?
James,
Hi.
we hear you. Please go ahead with your comment.
Oh, hi. Well, actually, my niece is the one that's actually suffering from this issue. Her mother's actually here, and she would like to. She actually has some questions about it, so I'll let her take over.
Hi, my name is Marilyn, and my daughter was recently diagnosed with schizophrenia. She was arrested for trespassing, and in Temple City, and the sheriffs did see, I guess, distraught behavior, and she was still released. She came home, she was still distraught. She was saying weird things, she was acting really weird, and she became aggressive, so I had to do a 5150 on her. She went to Aurora Charter Oaks. This has been happening in the past 2 weeks, and they released her. She still has distraught behavior, and I don't know what to do. They released her, and I don't know what to do. She's 22, and I don't know how to help her. I guess I just want to help. I can't. I've tried. If she doesn't know she needs help, how can I help her? I've called different places. I've called the 771. I've called different locations, and until she wants to get help, then that's when they're gonna help her. I don't want to call the cops because I don't want something bad to happen. So I guess I just want to know what to do. And that's all.
And that's exactly what NAMI does, and you should reach out to your local NAMI affiliate.
Okay.
And Jennifer, you want to give her my email address, she can email me direct.
I will do that. I will follow up with you. James.
I think that, again, this is something that a member of the commission staff will reach out to her. Unfortunately, we've really run out of time, and I know that there are a few people left who had signed up, and I apologize for that. You can still submit your comments to the commission website, COC notify at coc.lacounty.gov. So much that we've heard this evening, so much pain, so much thought, so much searching for solutions. And I want to first of all thank all of the panelists and the community members for sharing your thoughts and tuning into this absolutely essential and ongoing conversation. This isn't going to end here. This is one of those that is just the beginning. We have much work to do. We're going to end it here. Unfortunately, I know we could go on for hours. As I said earlier, our next event is a community listening session, Reflections on the Criminal Justice System, next Tuesday, April 27th at 5:30. I look forward to seeing you all there. To stay informed of upcoming community engagements hosted by the Civilian Oversight Commission and to register, please visit our website, coc.lacounty.gov. Once again, thank you all. Thanks to all the panelists. You've given all of us so much to think about. Have a good rest of the evening. Take a breath, and this concludes our town hall. Thank you.